Today I'm going to be going over the GlobaPharm case study. So as the interviewer is telling you about the client and the situation GlobaPharm is in, I would take notes of all the important numbers and information. And then once the interviewer is done telling you all of this, I would first confirm the objective of the case and make sure there's no secondary objectives you're missing. And this is also a good time to ask any questions you may have, preliminary questions. So then once you're done with this, I would take a minute, brainstorm your thoughts, collect your ideas. If there's any assumptions or trends that you're thinking of, make sure that when you go through the case, you state those out loud so the interviewer can follow your thought process. And this is also a good time to think of any frameworks you may know and if you want to apply any of those if you think they're applicable. So for the first question about factors to consider with this acquisition, I think with an acquisition, the factors that GlobaPharm would consider are about the product itself, so the drugs. There's also the business factor, so you're acquiring the business capabilities of BioFuture. So those would be the first things I would consider. So breaking those into buckets, my first bucket would be current drugs in the current drug pipeline, how have their drugs that are already on the market done, their quality, their price point, their current drug pipeline, the number of drugs that they could potentially go to market, how close are they to be going to market, the likelihood of success, and then their uniqueness, if they have fewer side effects, things like that. The next bucket is the future drug pipeline. So that encompasses their R&D capabilities. Do they have intellectual property that could help with long-term growth, their buildings or equipment or any investments they made, their talent, etc. From the business perspective, that encompasses BioFuture's marketing and sales capabilities, and also with an acquisition, there's a lot of times synergy. So could GlobaPharm and BioFuture combine or integrate their legal or finance departments, for example, things along those lines. And the final bucket I would want to consider is alternatives, because the interviewer did mention in the beginning of the case, there's 3 ways to acquire new large molecule R&D capabilities. So I'd want to explore building from scratch, partnering with a startup and acquiring a startup. And within the acquiring a startup umbrella, there are other startups besides BioFuture available that are important to consider and also take into account acquisition price and value. So moving on to question 2, evaluating issues with BioFuture's current drug pipeline. When thinking about this, the first thing I would think about are the drugs themselves, but I would also want to think about the market for these drugs and then also competitors in industry. So the first bucket, drugs, what's the R&D costs, sort of incorporate risk levels, so drugs have to go through multiple phases, clinical phases, and get all these different approvals, taking that into account, their potential selling value, the price, the cost, all of that. And then for the market, I would want to consider market size, how many patients have problems that this drug is trying to solve, market share, so if this drug has fewer side effects or fewer negative interactions with other drugs the patient might be on, that could set it apart and have it gain more market share. Also, if there's been any market demand or press about this disease or this drug. And then my final bucket, competitors, are there substitutes available? If we release a drug, how easy is it for a competitor to go and knock it off or make their own version, etc. So moving on to question 3 with the chart. This is always a tricky one for students. I think it's pretty obvious that there's no specific framework or shorthand formula to go about this problem. So really think about what the question's asking and recognizing there's 2 scenarios. The scenario where this drug tries to go through the phases and go to market normally, and then the second scenario with this $150 million investment in phase 2. So finding the expected value of the original scenario, you need to ask for the value if it were to go to market. The interviewer will give that to you, 1.2 billion, multiplying that by the probability it actually does happen, getting that number. Then in the second scenario, doing a similar thing, but the phase 2 probability is a variable and the expected value needs to be 150 million more than the original because we had that investment, solving for that percentage. And then for the final question, risks of integrating R&D functions, the buckets I would do are technical and scientific. Maybe they have different areas of expertise, things like that, logistics, there's a language barrier, time barrier, all of those things. And then finally, the people and culture, which I think is really important not to forget. Will there be poor management with this acquisition? Will BioFuture lose some of its entrepreneurial spirit? Will people leave? Will they have trouble acquiring new talent, etc.? So that is how I would go about this case.